Wilson's disease affects your liver. Wilson's disease, also known as hepatolenticular degeneration and progressive lenticular degeneration. It is a rare genetic disorder that causes copper poisoning in the body. It affects about 1 in 30,000 people worldwide. In a healthy body, the liver filters out excess copper and releases it through urine. With Wilson's disease, the liver cannot remove the extra copper properly. The extra copper then builds up in organs such as the brain, liver, and eyes. So, early diagnosis is crucial for stopping the progression of Wilson's disease. Treatment may involve taking medication or getting a liver transplant. Also, delaying or not receiving treatment can cause liver failure, brain damage, or other life-threatening conditions. In particular, talk to your doctor if your family has a history of Wilson's disease, because many people with this condition live normal, healthy lives. Causes and risk factors for Wilson's disease. A mutation in the ATP7B gene, which codes for copper transportation, causes Wilson's disease. So, you must inherit the gene from both parents in order to have Wilson's disease. This could mean that parents who carry the gene are at risk of passing it on to their children. And you have a 25% chance of inheriting the condition when both of your parents are carriers. However, the gene can skip a generation, so you may want to look further than your parents or take a genetic test. Signs and symptoms of Wilson's disease. The signs and symptoms of Wilson's disease vary widely, depending on which organ is affected. Therefore, they can be mistaken for other diseases or conditions. The doctor will detect Wilson's disease through diagnostic tests. Liver-related: the following symptoms may indicate copper accumulation in the liver, such as itching, jaundice or yellowing of the skin, pain or bloating in the abdomen, weakness, feeling tired, weight loss, nausea and vomiting, muscle cramps, loss of appetite, edema, or the swelling of legs and abdomen, spider angionas, or visible branch-like blood vessels on the skin. Many of these symptoms, such as jaundice and edema, are the same for other conditions like liver and kidney failure. Your doctor will conduct multiple tests before confirming a diagnosis of Wilson's disease. Neurological. Copper accumulation in the brain can cause symptoms such as insomnia, memory, speech, or vision impairment, abnormal walking, migraines, drooling, clumsiness with hands, personality changes, changes in mood, depression, problems in school. In the advanced stages, these symptoms may include muscle spasms, seizures, and muscle pain during movement. Kayser-Fleischer rings and sunflower cataract. Your doctor will also check for Kayser-Fleischer, KF, rings and sunflower cataract in the eyes. KF rings are abnormal golden-brown discolorations in the eyes that are caused by deposits of excess copper. Meanwhile, KF rings show up in about 97% of people with Wilson's disease. On the other hand, sunflower cataracts show up in 1 out of 5 people with Wilson's disease. This is a distinctive multicolored center with spokes that radiate outward. Other symptoms of Wilson's disease. The buildup of copper in other organs can cause arthritis, kidney stones, low blood pressure, menstrual irregularities, bluish discoloration in the nails, premature osteoporosis, or lack of bone density. Can you prevent Wilson's disease? Wilson's disease is an inherited gene that's passed down from parents to their children. So, if parents have a child with Wilson's disease, they could potentially have other children with the condition as well. Although you can't prevent Wilson's disease, you can delay or slow the onset of the condition. In particular, if you find out you have Wilson's disease early on. To greater than you may be able to prevent the symptoms from showing by taking medications like zinc. A genetic specialist can help parents determine the potential risk for passing Wilson's disease to their children. Treatment for Wilson's disease. Successful treatment of Wilson's disease depends upon timing more than medication. So, treatment often happens in 3 stages and should last a lifetime. Moreover, if a person stops taking the medications, copper can build back up again. First stage of Wilson's disease. The first treatment is to remove excess copper from your body through chelation therapy. Chelating agents include drugs, such as D-penicillamine and trientine, or cyprine. These drugs will remove the extra copper from your organs and release it into the bloodstream. Your kidneys will then filter the copper into the urine. Trientine has fewer reported side effects than D-penicillamine. Specifically, potential side effects D-penicillamine include fever, rash, kidney issues, bone marrow issues. Also, your doctor will provide lower dosages of chelating drugs if you're pregnant, as they can cause birth defects. Second stage of Wilson's disease. The goal of the second phase is to maintain normal levels of copper after removal. Your doctor will prescribe zinc or tetrathiomolybdate when you've finished the first treatment, or show no symptoms but have Wilson's disease. Zinc taken orally as salts or acetate, Galzan, keeps the body from absorbing copper from foods. Note, you may experience mild abdominal pain while taking zinc. Meanwhile, children with Wilson's disease but no symptoms may want to take zinc to prevent the condition from worsening or slow its progress. Third stage of Wilson's disease. After the symptoms improve and your copper levels are normal, you'll want to focus on long-term maintenance therapy. This includes continuing zinc or chelating therapy and regularly monitoring your copper levels. You can also manage your copper levels by avoiding foods with high levels, such as dried fruit, liver, mushrooms, nuts, shellfish, chocolate, multivitamins. Also, you might want to check your water levels at home, too, because there may be extra copper in your water if your home has copper pipes. Moreover, medications can take anywhere from 4 to 6 months to work in a person who is experiencing symptoms. So, if a person doesn't respond to these treatments, they may require a liver transplant. A successful liver transplant can cure Wilson's disease. The success rate for liver transplants is 85% after 1 year. Clinical trials for Wilson's disease. A few medical centers have clinical trials for a new drug called WTX-101. Wilson Therapeutics developed this drug for the treatment of Wilson's disease. Specifically, it carries a chemical named tetrathiomolybdate, which keeps the body from absorbing copper. It has shown to be effective for people in the early stages of Wilson's disease, especially in people with neurological symptoms. Click here to find more information on a center in your area. Advice for Wilson's disease. The earlier you find out if you have the gene for Wilson's disease, the better your prognosis is. Wilson's disease can develop into liver failure and brain damage if left untreated. So, early treatment can help reverse neurological issues and liver damage. Meanwhile, treatment in a later stage may prevent further progress of the disease, but it won't always restore the damage. People in the advanced stages may have to learn how to manage their symptoms over the course of their life. Next steps. Make an appointment with your doctor when you or someone you know may have Wilson's disease or are showing symptoms of liver failure. The biggest indicator for this condition is family history, but the mutated gene can skip a generation. You may want to ask for a genetic test alongside the other tests your doctor will schedule. Of course, you'll want to start your treatment immediately if you get a diagnosis for Wilson's disease. Early treatment can help prevent or delay the condition, especially if you aren't showing symptoms yet. Medication includes chelating agents and zinc and may take up to 6 months to work. Even after your copper levels return to normal, you should continue taking medication, as Wilson's disease is a lifelong condition. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.